When I think about the challenges of making a bipolar diagnosis, two things come to mind very clearly. We have two types of bipolar disorder. Bipolar type 1 illness is when a patient has had at some point in their life a manic episode. Bipolar type 2 disorder is when a patient at some point in their life has had that milder form of what we call a hypomanic episode. As a clinician taking care of many patients with bipolar disorder here at Mayo, that is really one of the most critical distinctions we must make right away. It really will then clarify what the treatment options are for that patient. I think the second challenge, and this is something we always struggle with, you can appreciate that if someone's having mild mood elevation, it's unlikely they're going to come see a mental health professional in a clinic. Most patients who have bipolar disorder live far more commonly in depression, and that is how they most often present to a clinic. So while depressed, and I recognize the importance of making that diagnosis with the symptoms that are in front of me, I need to be very comprehensive in my assessment and look for a past history of mania or hypomania, because then that essentially changes that diagnosis. That patient may have a depression in my clinic, those being their current symptoms, but a history of mania or hypomania makes that diagnosis bipolar disorder. And again, the treatment options are going to differ significantly than in comparison to someone who would just have major depression.